wonderful addition to your life. Right, so that as a reminder, this meeting is being recorded, just in case we need to use any of the footage later. So again, keep your camera off and you don't have to worry about that. If you have questions while Eva and Nicole are talking, feel free to just drop them in the chat as we go or save them till the end to drop in the chat then. And Nicole will pull some from the chat to answer at the end. So we'll just have a few minutes of conversation first, and then we'll get to the questions, which I hope you all have. That being said, welcome, Nicole. Please come on camera, which you are already. And Eve, thank you so much to both of you for joining us today. And let's get started. Nicole, go ahead. I'm going to go off camera.
So first of all, I want to thank everyone for being here and for pre-ordering Rattled and for most importantly, supporting maternal mental health. And I want to take this moment to thank you, Eve, personally for being here. For everyone, Eve is a New York Times bestselling author of Fair Play, author of Find Your Unicorn Space, as well as a Harvard-trained lawyer and thought leader and advocate for reducing the chore gap and advocating for fair domestic labor. And I want to just thank you for all of your incredible work and for being here today to support the launch of Rattled. And so I know the last time.
Exciting.
Yeah, thank you. Thank you so much. And I don't know how you have any time, you're just so generous with your time and I really appreciate it. I see you doing all sorts of incredible things and I just don't know how you have time, but I wanted to know, so the last time I saw you, we were at the Psychotherapy Networker Conference, and you gave this amazing keynote and workshop training mental health professionals to integrate fair play into the therapy space, which I think is an amazing resource. And fair play, I know that not a week goes by where I don't have conversations using fair play methods and division of labor and talking about, a lot of the incredible tactics and strategies. So I'm just letting some people in that you promote in the book and in your work. And so I just wanted to get an update and see you're involved in so many exciting things. What have you been up to lately and what are you most excited about?
Well, I'm really here to ask you questions because I have so many of them for your book, but I really appreciate you having me here. Yes, I think our work intersects really beautifully because I'd say it's just one word that can make all the difference, and that's expectations. And so what fair play is about, as one woman said, I think she just summarized it so beautifully in one sentence. She said that it taught her she didn't have a magical vagina that whispered in her ear what her husband's mother wanted for Christmas. And what I think your book does is in the same way that those assumptions based on gender, I think, mothers shoulder so much of the research and the burden, especially if something doesn't go well. And I think you turn that on its head. So
Cindy, please come down.
I have many, many questions for you. So can I turn the attention on you and ask you questions?
I mean, of course, I'm not going to say no to you. That's incredible that you're thoughtful about this, and you always are. And I just appreciate your efforts and your interests. So yes, absolutely.
Well, as Rattled came out, I mean, I think again, it's so important. Finally, I think there's books coming out that sort of change this narrative that what to expect when you're expecting just basically tells you, your child is going to be the size of like a jelly bean. This is one of the first books I've seen that really sort of digs into, how to really prepare for motherhood and then what happens after you. But I would love to hear from you as you launch Rattled, sort of why did you write this book? Why now? I saw a beautiful TED Talk that you've given. Your message has been out there, but why did you think this book needed to be on the shelves?
So my academic research was focused on the caregivers, right? And then caregivers of patients with medical illness. But over time, I started becoming fascinated, with that silent patient in the room, the caregivers. And then fast forward in my personal life, I became a mother of two. I went through postpartum twice, and I felt like I was sort of blindsided, and there wasn't much conversation about how to prepare the mother for motherhood. And then going through my own postpartum journey, as well as coupling my strong academic background in research, knowing how to better support caregivers, I realized mothers are the ultimate caregiver. And I wanted to translate all of those resources to mothers. And then as I was sort of, as a researcher, going into all of the science and the literature, I discovered there's a huge story here and an opportunity that no one's talking about. We have this derogatory, stigmatized view of the mom brain. And really, there are great researchers out there understanding and investigating the strengths of the maternal brain and plasticity and all of this profound development. But there are so many barriers for mothers to reach their full potential in early motherhood, between postpartum mental health issues, 1 in 5, I've seen rates as high as 1 in 3 for postpartum mental illness. It's the #1 complication in childbirth. We can't really talk about early motherhood without talking about postpartum mental health. And then I saw that there were these opportunities to talk about trauma and post-traumatic growth, because birth trauma occurs in 13% of mothers. Becoming a mother is its own normative trauma. 1 in 3 women will experience a sexual assault. There's childhood trauma, the mother wound. I mean, a ton of this stuff that I get into in the book, but there's this phenomenon called post-traumatic growth, where we can bring mothers to the other side. And I really see it as a missed opportunity, where we're not having these conversations around trauma, around the maternal brain plasticity and the potential for brilliance, postpartum mental health treatment, and also self-directed neuroplasticity, which is basically nurturing the process of this huge transformation into motherhood, right? And not to mention mom guilt, mom shame, mom rage, division of labor, baby bonding. I mean, all of these topics we're not preparing mothers for ahead of time. And I think it's a missed opportunity. And I think you're right. We have more books coming out and more advocacy in this. And I just think the more voices, the better. And with the health disparity of 4% of research funding only going to women's health issues, we have a lot of catching up to do. And while all parents experience brain changes, and we know fathers experience postpartum 1 in 10, I really feel like the time for mothers is now. And so that's why I'm focusing solely on mothers mostly in this book.
Yes, and I think we really, really need that. And if you had the book, can you tell us a little bit about the roadmap? Because I thought it was actually a really beautiful roadmap. How did you decide how to structure the book?
Good question. So I wanted to get sort of the foundational pillars down. So the postpartum mental health treatment, I sort of introduced that early on. And then I wanted to talk about the general transition to motherhood and matrescence, right? This identity change, what a profound opportunity it is, and all of the relationship changes and identity changes that go into that, as well as how to make use of it, as well as the state of the science, right? So we know researchers at Yale have now deemed this a neurocognitive developmental phase. And so I wanted to introduce that early on so mothers can understand that they go into this as an opportunity for growth, right? And to take it, seriously, and to understand what a seismic transformation it is. So I started off with those chapters, and then I got more into the nitty gritty of the emotional changes, the mom shame, the mom rage, the mom guilt, right? Baby bonding and disappointments, division of labor as well. And I draw from the fair play methods as well, which was really instrumental. And then I so the first pillar I focus on is postpartum mental health, because we can't get to the next pillars until we establish postpartum mental health. You can't really make use of matrescence and these later, more evolving strategies and growth opportunities without having solid postpartum mental health. And then I get into matrescence, development and identity and emotional changes. And then I sort of take it a step further and I talk about self-directed neuroplasticity, post-traumatic growth, things like that parallel to your unicorn space, like how to get creativity and mom flow and making that space for you. But I think you would agree, we've talked about this, that you can't really make use of unicorn space if you're depressed, right? It doesn't make sense. You have to have that foundational pillar set. And then you get to sort of go up this spiral of development. And so that's really how I wanted to sort of set the timeline out. Like, first, let's get this in place. Let's set you up for success, like Maslow's hierarchy, right? Get your needs met, right? And then work your way up to like this fully fundamental transformative process that can bring you to the other side and better than ever. I feel like it's an opportunity for growth. I mean, your brain is just developing exponentially.
I wish I sort of took it seriously. It's like what you said, you know, you're sort of thinking about, or at least in my case, you know, people had sort of misdirected me to, you know, lists of registry things I needed for the baby, like what type of crib to buy. I was sort of misdirected into just thinking about what my maternity leave would look like and what it would look like to go back to work. But I never really actually stopped and focused on, as you said, looking at matrescence or, you know, postpartum as a opportunity. It just seemed like a phase that we all just sort of had to slog through. And then, as you said, you're right. I mean, part of fair play was understanding that even in the division of labor, when people were using fair play and getting time back, I would have mothers say to me, well, it's too late for me. I have a passion gap. You know, my kids are in fourth grade. I'm a parent, I'm a partner, I'm a professional, and I'm stuck. And I know Adam Grant uses the word languishing, but the words that we saw in our research were related to this period of life, were two ones that sort of alarmed me. And I'd love for you to sort of talk about this. But we saw in our word cloud over and over again in 16 countries that women were overwhelmed and bored.
Right.
So for me, if I'm overwhelmed, I want to be overwhelmed because I don't know, I'm on a whirlwind, book tour, and I'm overwhelmed from, just a dopamine explosion. Or if I'm bored, I want to be teenage bored where I get to sort of sort of linger in my house and look at, the stream. But overwhelm and boredom together felt really alarming to me. And then on top of it, I feel like understanding mental health has really taken its, a dive, because when I asked people what the opposite of languishing was, most people said to me that they wanted to be happy. But as you and I both know, right, mental health is more of having appropriate emotions at appropriate times and having the ability and strength to weather those emotions. And so I think you talk about that. How do you weather the emotions of postpartum isolation in America when we literally have no supports? Like if we have appropriate emotions, which are guilt and shame, and you talk about those beautifully, and rage at appropriate times, which is pretty much the whole first year of my child's life. How do you weather those things? What did you find?
So all of the strategies that I recommend in the book are based on cognitive behavioral therapy approaches.
Yes.
So evidence-based, and really how to contain these emotions and manage them. We're not trying to get rid of these very normal emotional experiences or typical emotional experiences that are so common. We're really teaching how to navigate them in the best way possible. However, as a clinical psychologist, I also look at all of these emotions with a diagnostic lens, right? Because it's on a continuum. So I look at how often are you experiencing mom guilt or mom rage or mom shame? How distressing is it for you? And is it actually impacting your behavior? Because it's very important to know these things, because if you are feeling mom guilt about going out and doing the things like connecting with others, right, to combat isolation, or exercise, or going outside for a walk, or something, anything to help you manage stress, and the mom guilt is saying, I can't do anything outside of my baby, I have to just be completely focused on my baby, then you're actually going to you're going to feel more depressed, right? And vice versa. So I look at it through a diagnostic lens, and so that's why we really need to manage it in a helpful way, because it's just a vicious cycle. Because if you don't go out and do the things that you need to do, then you're just going to make your mood worse. And then you're going to have more experiences of mom guilt, mom shame, and mom rage. You're going to feel more, overwhelmed and overstimulated and depleted. And it's just terrible. And so we know that the evidence-based treatment for depression is not like the flu where you sort of lay down and wait it out for it to pass or rest. You actually have to make yourself do those things. And then you get the benefits of doing those things. And then you feel less depressed. And then you feel less mom guilt, less mom rage, less mom shame. But it doesn't mean it goes away completely. It just means that we turn down the volume so that it's manageable.
Yeah, well, I think I love your tools, and I think your book has so many wonderful tools. Can we talk a little bit about guilt?
Mhm.
You have a lot of important, sort of research and advice around guilt. Can you tell us a little bit about how you look at guilt?
Sure. So, I mean, I look at mom guilt in the same way that, Brene Brown does a lot of research in this area.
Yes,
And
yes.
so the differentiation is that mom guilt is I did something bad versus mom shame is I am bad. So mom guilt is just a little more, I guess, surface level. It's more, typical what we would say. It's not as directed as like your core beliefs about yourself. And so what my method for mom guilt is the double down method. And so what I say is if you decide, I get a lot of moms tell me that they feel guilty going back to work. I'm sure you hear that a lot as well.
Yes, of course.
Um, okay, so imagine you're a mom, you're feeling guilty about going back to work. So you go to work and you show up, but you're there physically, but mentally you're back at home with your baby because you feel so guilty about being there and you're torturing yourself and you're just stuck in this like, feeling terrible. And of course it's an adjustment, right? This doesn't happen overnight, but what I'm saying is the double down method is to find ways, and it may be different than the way you worked pre-baby, but to look at it as an opportunity with curiosity to how to make it work for you now and how to make it better, how to lean into it, how to gain more pleasure from your work experience, right? Maybe you need to meet with a colleague for coffee or engage in more social meetings. Maybe you need to take on a project that is more mentally stimulated to sort of get you out of that mom brain. And in that sense, you can bring yourself into the thing you're actually doing because you've committed to doing it anyway. So there's no point in feeling, going into the mom guilt. Mom guilt has no productive function whatsoever. And so we want to get you leaning in, experiencing the benefits of being back to work, or that girls' night, or that exercise class, or that walk around the block, whatever it is that's making you feel guilty. Lean into it. You get the benefits, then it becomes more restorative, replenishing. You feel more self-confident when you can take on a project at work. You're, developing your brain further. You're thinking differently. It's an opportunity to really enhance your resiliency. And then as a result, you experience less mom guilt overall.
I love that so much. And I love Esther's comment here. Like, do we experience guilt forever? Of course we fucking experience guilt forever.
Yes.
That's the patriarchy, guys. That's what we're living in. But yes, so do you think, as Esther's question posits, does it get easier? Or does it get easier with time? Or I'm gonna guess what you're gonna answer. Or do you have to sort of practice?
Do you want to guess or do you want me?
Well, I think you're going to tell us that from what I'm reading it. I have your book on Kindle because
Uh-huh.
that's sort of that's my guilt and shame that I read on Kindle, and I really should be reading on big books, but I always read really late at night. But yes, I think you're going to say that it's both, but that also practicing these skills are important.
Right. So, right. I'm going to say both. One, I'm going to say, so you talked before about having both like the overwhelming boredom and the, overstimulation. I always say "and" is the most important word in therapy. And the same goes for mom guilt. You're going to experience mom guilt. Ambivalence is the hallmark of motherhood. That push-pull is always going to be real. Now, again, we're looking at how intense, how often, how frequent, and how does it impact behavior. So if all of those things are managed, right, you're still going to have some mom guilt. And I do think also it gets, I don't know if it gets easier, but it gets different, right, through different developmental stages throughout life where you are, but I can say, I can't really say that we get rid of it completely. And I can't really say that it's easier. I think with practice, it gets easier to navigate and manage, right? So I guess that in turn makes it easier, but absolutely it changes and it becomes different.
Yeah, and I think, what was interesting in our research for Fair Play was that we saw something interesting happen, Nikki, and I wonder if you see this in your practice, but we saw that that in our stories and sort of collecting, 10 years of longitudinal data of women, guilt and shame were interesting emotions
Mhm.
because there were other emotions like mom rage, or sadness where you're sort of in them. But what
Mhm.
was interesting about guilt, and shame, those two together, were that they made women act in a short term, they changed their short-term behaviors.
Mm,
So
mhm.
what I found really fascinating about it was like, for example, one woman I met in the unicorn space for the unicorn space book, she had read Fair Play, where we introduced this idea of unicorn space, that you get to do something that says, I can't believe I just did that. Like, that's important. I can't believe I just did that. That pride and that joy in something other than being a parent, partner, and professional is
Mhm.
linked to your longevity and your mental health.
Mhm. Mhm.
So she decides that she believes that, and she wants to be unavailable from her roles to play piano. She goes and she purchases sheet music. She's a single mother. She has a Juilliard. She lives in a rent stabilized building where Juilliard students live. So there's a music room in her building. So she like signs on the whiteboard that she's going to take an hour from like 3 to 4. So she goes and just starts practicing like her Hamilton show tunes or whatever. And she says that she notices that the sun is setting. It's, dark, it's winter in New York, gets dark early. And her heart starts pounding because she knows her baby, her young child, doesn't like being in daycare when it's dark out. And so she says that she's left the music there.
Mhm.
She just walked out.
Yeah.
And that's what I think is really interesting, and if you could talk a little bit about that, because what we saw was that we know long-term, it's in her value system, as you said, to sort of lean into that, that the music.
Mhm. Mhm.
It's a very big part of her identity outside of her roles. It's going to be good for her to play music as a mother. But it was so interesting that in the short term, she couldn't hold on to those long-term views.
Mhm.
It just was immediately guilt and shame happened. And so she changed her behavior in the moment.
Right.
And so I wonder, how do you interrupt those behavior changes when guilt and shame maybe will make you do something short term that you maybe not want to do long term?
Right. So, I mean, if I were working with this patient, if I were
Yeah.
giving strategies from the book, I would say, okay, and I talk about this in this sort of mom flow, right? We're all familiar with
Yes, I like the
flow, where
mom.
it
Yes,
takes,
I'm looking at that. Yes,
yeah.
I
So
love part two.
I would work with this patient, this person, first on problem solving, right? So maybe she wasn't aware of how strongly she would feel picking that hour of time. And so maybe it's just about moving the hour, if possible, to another time. Maybe it's about only doing a half hour or 20 minutes and starting there. Or maybe it's one song, right? So setting her up for success where she could just start to sort of build those neural networks again with music, right? And you can see them developing, but maybe it starts with 1 minute. And so it does take practice, but it also, I would work on cognitive restructuring in terms of a healthy reframe, right? So I would tell her, you're also serving a model for your kids and your babies that it's okay to have a life outside of me, mommy. It's okay if I have a life outside of you. And who being a role model for engaging in the creative arts and your talents and your passions will benefit the baby long term. So in the short term, I would say, okay, some deep breathing, it's not an emergency, even though it feels like one, right? And so that panic and that intense emotion will go away if you do nothing. But if you do some of the relaxation strategies, settle into it, it will go down just to even get through one song, maybe the first day, or 2 minutes of playing on the keyboard, just see how it feels. But the problem is that it becomes so intense, those emotions, that we usually have to feel like we need to react right away. But I remind everyone, and I remind readers in the book, that it's not an emergency, even though it feels like one, right? And so let's
I
try
love
and
that
sit with
part.
it a second longer, 20 seconds longer, right? This is all new. Give yourself some grace, right? Your baby's not in danger, right? It may be uncomfortable, right? It may be true that the baby doesn't like being at daycare when it's dark, right? But no one's going to die from discomfort, right? And in the long term, we're practicing and we're taking small, manageable steps.
I love that so much. An emergency, I think, can really, and I love part 2 of your book because I think it has so many practical
Mhm.
applications for all of us in different stages of motherhood. But I love that idea that is this an emergency? Because it can really start interrupting, I think, some of that short-term behaviors where, over 10 years, we've seen so many women do things that, looking at them from the outside, you'd say, like, you didn't have to do that. Like, it's okay.
Mhm.
Canceling work trips,
Mhm.
canceling, college reunions because a child is upset that you're leaving. And I think what we found, and I know you talk about this as well on Instagram, and Dr. Becky talks about this, but I think what's so important is determining what is other people's discomfort and what is true guilt and shame, right? So typically, guilt is not seen as something that's in alignment with your values. So
Mhm.
I do feel like that woman deserved to play that piano. It's in her values, as you said, to build her
Mhm.
neural network back of her brain, and to uh, embrace music. Like that's part of her value system. And so if she knows that I can't feel guilty about something that's in my value system, I can anticipate other people's discomfort. And she
Mhm.
was definitely having an emergency of anticipating her child's discomfort. So we try, at least what I've learned over the past 10 years is trying to make that connection. Is this other people's discomfort, or is this really guilt where I'm doing something of alignment with my values?
Right, and you could see how this could lead to worsening her mood and more increased feelings of mom guilt and mom shame,
Yes.
because by not doing the thing that's actually going to help her feel better, like playing music and, nurturing creativity, and resiliency, she's going to feel worse overall. And so you can see how it's really a self-defeating process. And we really want to help mothers, even if you don't feel like you can do it, fake it till you make it, right? Even if you suffer through that minute of playing, right? It's 1 minute more than you were playing before, and it's a building block. And so that's really an important message. Yeah.
And I love your building blocks because, um, it can feel like sort of useless. Like, what's the point, right? And then if you start going down that path, then it's not great. So let's talk a little bit about part 3 of the book, which I thought was also really important. Can you talk a little bit about uh, so this really interesting chapter, how to self-direct maternal neuroplasticity? I'd never heard. I mean, the way you write about it is very different than what I've seen out there. Again, like you said, mom brain is sort of talked about casually as like I'm dumb or I'm distracted or overwhelmed and bored, Shira, as we were acknowledging in the comments. But you have this really great sort of, once the roadblocks are cleared,
Mhm.
sort of a roadmap for what we can do with this idea that we're in this new sort of neural phase or cognitive phase. So can you talk a little bit about that part? Because I've never seen people really write about this part of the mom brain in this way.
Right. Well, I mean, I think that, Mom Brain needs a rebrand, right? And so there was actually a JAMA article that came out recently that was talking about this and some of the maternal brain changes that occur and the differences. So, I mean, overall, becoming a mother is a neurocognitive developmental phase. Your brain changes rapidly, fine-tuning itself and priming itself for new learning and shedding useless neural networks, known as synaptic pruning. And I always say it's like Marie Kondoing the brain, right, to give moms a leg up in caregiving. So it's really reorganizing. But if you think about it, it's all new learning, right? So you become a mother and you've never done this before, or you become a mother of 2. You've never been a mother to 2 children before, and you can go from there. But it's trial and error. It's problem solving. You're learning increased, efficiency and leadership skills and client satisfaction skills and anticipating needs and empathy and all. And we're starting to see some changes in the research between, there's really not strong evidence for differences in memory functioning between mothers and non-mothers. And so I think that's really important to state that. And I state that in a very careful way to say that the subjective experience of mommy brain is very real. So we do feel fogginess, forgetful, interrupted. And that's probably due to the mental load, right? These exponential tasks that we have to think about now, as well as lack of sleep and being depleted. But in addition to having that subjective experience, it actually doesn't map on to significant differences in the research. And actually there's some new research being done that's showing that there are actually cognitive boosts that come with maternal brain changes. So increased efficiency, mental flexibility, and things like visual memory, right? And I think we can only go further from there. Hopefully in the future, we'll have a lot more maternal brain plasticity research, and we'll map on the actual, like a lot more of the boosts and do brain mapping and all of that. But right now I wanted to translate the science in an easily digestible way and get out what's there now, right? Because of the health disparity in research, we need some catching up, right, in the research realm. And so therapy rewires the brain. We know this. So it's actually an opportunity when you become a mother to grow more and to develop further. I think my therapy went that much further, right? Because my brain was in a prime state of learning. I was like taking it all in. I'm building these neural networks related to my baby. Let's infuse some learning and some resilience building for mom and teach moms how to care for themselves, right? If we're in the process of teaching them anyway, and their brains are sort of set up for that. So therapy is a great way to do that. I talk about other skills that other people have talked about, like Rick Hansen. He does a lot of neuroplasticity work, but so like it's leaning into pleasure, it's making things bigger, it's enhancing resiliency, it's cultivating mom flow and engaging in unicorn space activities, right? These are all strategies for how to enhance that self-directed neuroplasticity and kind of ride that wave, but gear it, in the direction of becoming better than ever and thriving.
Well, I think it's so important that there's a both and here, because what I hear from the generation above me, especially when I'm on like tour for Unicorn Space, Find Your Unicorn Space, is that there's a time and place for everything. And you can't expect women to do both at the same time. Let them be mothers, let them be parents and partners and professionals. And then when they retire, they can take up pottery. It's a very pejorative, I think, and condescending way to sort of talk about this flow and learning that we can be doing in a both and state with motherhood. So how would you combat some of that sort of old school thinking?
Well, I would say that when you're engaging in activities or meaningful things that are just for you, you're going to be a better mother to your kids, right? You can't serve from an empty vessel, right? And we want to take that further. It's not just about faulty self-care. It's about really enriching experiences that are going to help you develop and feel like it's meaningful to you, that there's growth there, and that you're feeling fulfilled in a lot of different ways. And it will help you be more present for your babies, and it will help your mental health, which we know that solid mental health is the most important predictor of childhood well-being. And so all of this, it's counterintuitive, right? I think there's a mother martyrdom culture out there where the more you suffer as a mom, the better mother you are, right? Sacrifice all your needs. And I talk about this early on in the book as well. And that makes you the better mother. And it's counterintuitive. It's not true. And I think that you can have both and all, not at the same time, right? Not necessarily in the same moment, right? But that's why it involves some problem solving, some structuring around that, some protected time, like you mentioned in Unicorn Space, and how to do that, and how to, really talk to yourself in a way that's going to boost you up to get to do those things that are going to help you.
I love it. I think that's so important. Okay, I would love to get some more questions. Alana asked a really good question. And if you have any more questions, please just come on the chat. Is there a benefit for a reframe that isn't centered around I need to have pleasure and relax because it is better for my baby, but also that mother's growth and development and well-being is important because they're humans, like they're people? Yes, I think that's a very important reframe too, Alana. So thank you for that.
I think that's incredibly important, and certainly the message of the book. Of course, mothers in their own right deserve to feel their best and grow and, and develop. And just because they are people and individuals, we all need this for, for lots of reasons. And so absolutely, that's a very important point. I support that. I think the reframes that I'm saying around the baby can help mothers when they're so physically, in the newborn phase, the baby is essentially attached and the maternal brain is biologically wired to protect the baby and orient to the baby in all of these encompassing ways. So it's sort of a way to just get some room there for the mother to sort of free herself to think in this space. And yes, absolutely, mothers in their own right deserve this as well. So I hope that that's the message being portrayed as well.
And yeah, and I feel like that's what, this book, it does feel very, you don't just have to sacrifice. I mean, you don't have to just, do all this stuff in service of your motherhood. I did feel like it's very validating that you treat mothers as humans and humans with advantages possibly in this stage of life because of this neuroplasticity, which I think is really interesting. That in a way, it's really interesting because I thought one of your reframes was, well, if I'm going to, be a trapeze artist as a new mother, this is the exact time to do it because I can learn better. And so then that way you can sort of set those boundaries better by saying, I don't want to waste this window, guys. So like in my division of labor, like I'm going to call on my partner for many, many of what we call the fair play tasks, because I don't want to waste this opportunity of learning. So I love that so much. Okay, so here's some more questions that came in from those who couldn't be here but bought the book in advance. Do you find that high achieving women have it harder in the transition of motherhood than women with a more easygoing personality? I don't even know what that means, so I don't like the question holder. How can, because I think we're both high achieving and we can be easygoing depending on therapy and your cognitive behavioral tools. How can those women adapt to that high achieving personality to the challenge of motherhood? But I do think there is a stereotype that somehow type A mothers bring that type A. We see that all the time where a big fair play movement piece is that I ask women not to, to serve on any school PTAs unless there's gender parity on the PTA. Because there's all this sort of joke, like I'm a type A mother, and so I'm going to bring all that type A skills to like the PTA, and then it sucks up all your time and unpaid labor. But I think, let's just ask in general, when you been labeled type A, or you're somebody who's so good at completing tasks because you've been excellent at everything, does it make it harder? Because I know for me, for sure, that being excellent at things in my life, it felt much harder to be a mother where I felt supremely non-excellent at anything I was doing.
100%. I mean, I specialize in treating high functioning anxiety and depression. And so that looks different than clinical levels of anxiety and depression. And so when it comes up postpartum, it's like, mothers are afraid to report their symptoms for fear that they'll be viewed as unfit. And they also don't know how much they're suffering. So they're used to being high functioning and white knuckling it through. And I'm saying, wait a minute, as a clinical psychologist, I can scratch the surface and tell you, no, actually, this is like high functioning depression and anxiety, right? And that it's okay that this is, an opportunity to learn, and that you're not supposed to know how to do this automatically. But I do think it does become a struggle. And I do cite some research in the book where it does show that those that have more high functioning anxiety, that you're more likely to suffer postpartum when you have that high functioning anxiety. So I want to sort of validate and normalize that. But I also, this brings me to another point that I wanted to bring up. And of course, if it's okay, I'd love to ask you a question.
Yes, of course.
This is you're on the front lines and doing so much advocacy. And one pillar that I am advocating for is really incentivizing the maternal brain and thinking about companies and employers incentivizing maternity leave upfront, because it is such an opportunity. And I call Becoming a Mother a natural employee development program. And so you have your finger on the pulse. So I'm curious as to what you would think. Do you think companies and legislature and society as a whole are open to a conversation about how mothers can actually be a good return on investment when they come back from maternity leave, if you fund them and support them and help the process go right and help them achieve this brilliance and, get, reduce postpartum rates, and they can actually get to this point of thriving and bring all of these enhanced skill sets back into the workforce? I mean, do you think that I know that we're advocating for paid parental leave, and that's great. I'm sort of taking it, a step further, like,
Yeah.
wait a minute. And I'm really like pushing it for moms. I think we've been, held back. We've been paid less than men, over time. And there's the motherhood bonus the fatherhood bonus and the motherhood penalty that is pervasive. And so I'm really trying to send that message and advocate for that as well. And I'm wondering what your thoughts are if you think that we're open to this type of conversation.
I do. I think that I think we got closer than ever to getting federal paid leave under the Biden administration. I think the word caregiving is now, a noun, like a real noun, like it's being used by this administration, at least. If I think a lot of the work that's been wonderful and done has been on the state level. And I see there's a lot more traction on the state level. I think we have to be prepared that we're possibly going back into a Trump administration in the fall. And so there's going to be probably less of a focus on the caregiving agenda. But I will say that Biden has done a really beautiful job. Build Back Better didn't get done, so we still are far off from that. But I also think, like you said, Nikki, this is what I call an Overton window problem. You have to change culture for policy then to change. And so part of your book and what you're doing and what other sort of scholars in your area are doing, and I would include Rashma Soojani in that, in her work at Moms First, is pushing forward this idea that mothers are a return on investment. In a capitalist patriarchy, we still have to talk in those terms. And we are a return on investment. But I think for me, it's that the implicit bias is so deep that even if you can convince people that mothers are a return on investment, we're still so far behind. So I'll give you an example. There was this really great father who's a CEO of a company who said that he had implemented fair play with his partner, and that he was sponsoring 2 single mothers on his team with young kids because he really wanted them to have growth. And I was like, that's awesome. And so he came to me because he wanted, so I don't know, accolades, a pat on the back for that or whatever. But so I was listening to him, and then he's talking about the sponsorship of these women and, getting them high positions and their career growth. And again, motherhood is a return on investment. But then towards the end of the conversation, I asked him, I said, well, just tell me about your family structure. I'm always interested to hear what the family structure is of the CEO. So he tells me, oh, I have 4 kids. And right now, there's just no way that I could do my job and hold the fair play cards. So again, we did the fair play cards. My wife holds all the unpaid labor, but I really see it, and I treat her as a partner and appreciate that labor. But that's sort of where we are right now. So what I said to him is, okay, you spent the first 40 minutes like telling me that you were going to sponsor these 2 single mothers, but then you just said from your mouth that those women couldn't do your job. You literally just said, I couldn't do my job unless my partner off screen handled all the unpaid labor.
Right.
So what is that implicit bias going to say to him? Eventually, as these women rise, he's going to say, these women can't do my job, or I'm not going to hire them to do my job because they have commitments and obligations at home that they have to attend to. That is the motherhood penalty. The motherhood penalty is we have the assumptions that we are taking care of the unpaid labor, everything off screen. So we're less committed to the workforce. So I think it's so implicit that we can say we can say we need a return on investment on women until we're blue in the face. But until we invite men into their full power in the home, I don't actually think those policies are going to have as much traction until men are actually the ones. And so what I say to them all the time now is I don't really care about servant leadership or your ability to sponsor a single mother on your team, I want to know what the name of your child's dentist is. And then all of a sudden the conversation just sort of sometimes it just freezes, you know? Okay, so let's move on to our last question, because I promised everybody would be gone before the hour. And thank you so much for this book. It's a really, really important addition to the canon of motherhood. Dr. Pensak, thank you. Okay, how can mothers, and if there's any last questions, throw them in, but I think we could wrap on this and then have Nikki tell us where we can find her and support the book. How can mothers who have had a very difficult experience with their first baby prepare for a better experience with a second baby? Oh my God, that's a great question. And you have a lot of great thoughts on that and Rattled, but talk to us a little bit about that.
Well, this is why I tell all women, friends, family, whoever will listen, all my patients, right? Set up your postpartum mental health care plan. As soon as you pee on that stick, when you're starting to think about family planning, you want to get your postpartum mental health team in place, whether you think you'll need it or not. Yes. Hopefully you won't, but it's there, it's set up. So I say establish care with a prescriber and therapist that specialize in postpartum, because they know what they're looking at. And so oftentimes you hear it all the time, women get dismissed by healthcare providers who are well-meaning, well-intentioned, but they just don't know exactly what they're looking at. And so you want someone with that expertise, and you want to set up and also it takes some time to get into a doctor's office, right? To establish care. It takes, this way your provider can get a good baseline assessment of you so they know what your changes are, they know you. And also therapy is like dating a little bit. You kind of it might take a couple tries till you find the right therapist for you that you feel comfortable with. So that's why I say get started early on, and then you'll want to do your first prescriber and therapist check-in 2 weeks following baby. That way you're out of sort of that baby blues period, right? But you can check in and have that support there. And then at regular intervals following that, but let the doctors do their job. I'm so sick of women getting like self-checklists of depression and anxiety. I'm like, wait a minute. No. Just let the doctors, we want to take care of you. We'll assess you. Take that off your plate. You don't need one more thing to do. Just show up to your doctor's appointment. And a silver lining from COVID is that telehealth can be done. I have patients breastfeeding in session, right? And like I'm in their houses. So, definitely set that up. And then your prescriber and your therapist can tell you when they think the follow-up should be, based on whether symptoms are occurring or not, and how intense they are. Okay, so there's a continuum there, but then also we know that there are certain vulnerability markers postpartum, like if you cannot breast or chest feed, following birth, we see a rise in postpartum after that due to the hormonal changes. But if you do chest or breastfeed, then you get when you start to wean, that can also be another uptick in postpartum. So we want to be mindful of that. But mothers, the onus unfortunately still falls on them to set up their healthcare plan and their team. But let us take that off your plate in terms of show up for the appointments. Let us take care of you. We'll diagnose, we'll assess, we'll guide you in terms of timeline and all of that, and we'll give you the treatment, right? And 100% of postpartum mental illness is treatable.
Well, I think if literally it's so clear when you say it and you talk about this in Rattled, but I don't think that I've ever heard it as clear from anybody else. So what I will say is, please continue that message, even that message of if every mother in America was willing to ask, what is my postpartum mental health plan? Mm-hmm. The world would literally be a different place. I mean, that question could not have been farther from my brain. Yeah, literally for every single child, including the third. So, but then maybe I wouldn't have written fair play because I wouldn't have had a breakdown. So sometimes, things happen the way they're supposed to, right? Yeah. Oh, I love it. So Cheryl says, I'm so glad awareness is being brought to this topic. Stay-at-home mom is difficult as well. Women need tools to not feel guilty when they work or stay home. Balancing love and time with your own needs is tough. Cheryl, oh my gosh, it's the perennial question, I think. And it's gonna get more tough. I think as, again, our reproductive rights are taken away and people are forced into motherhood. So I think we have a long road ahead of us. Mm-hmm. And I just want to say, Dr. Nikki, or I don't know what people call you, Dr. Pensak, Nicole, you are really, really thoughtful. And even the way, like I said, the book is laid out is so reassuring. So thank you for this voice, and never stop talking, please.
Oh, Eve, thank you so much. You are incredible. You're amazing. And I want to thank you for your work and also for being here for this interview. Incredibly thought-provoking. And it's just always a pleasure to talk to you. And I just thank you for your work and your time. I can't thank you enough. So
let's talk a little bit about so Alana, thank you so much for saying I would love to support the book. Obviously we all have bought it, we'll buy it for anybody in our lives as they become mothers, and men too, as they enter any phase of caregiving, they could definitely use this book as well. But tell us sort of where you want us to buy the book. What would you like us to do? I will say to all of you out there who listen to this on recording and who are with us live, there are really two things I will ask on behalf of Dr. Pensak now. If you could, even if you didn't buy your book on Amazon, it's very helpful to give it a 5-star review there. So please do that. And also a 5-star review on Goodreads, because Goodreads is a really weird platform. So please do, and Amazon brings up Goodreads when you pull up an Amazon purchase. So even if you hopefully support an independent bookstore, please just, even without buying the book there, you can still give 5 stars on Goodreads and Amazon. So that helps with us with the algorithms for authors. So please do that.
thank you for mentioning that. That is really important. And I would appreciate any reviews. And also, if you want to email me direct feedback, I'd love to have more thoughtful conversations about that. But please follow me on Instagram at Dr. Nikki Pensak as well. I'll be giving updates about the book tour, book events, and also I'll continue to post this content and keep speaking on behalf of all of the things that we spoke about here, Eve, and more. And so, yeah, that would be great. Thank you.
Thank you so much to both of you, to Dr. Nikki and to Eve. This was so wonderful. I feel like I learned a lot, even though, of course,
Yes.
I read the book myself. So just repeating what Eve said about reviews being super helpful. No matter where you bought the book, you can always review it. That's always a helpful thing to do. Sharing it, obviously, word of mouth is everything, especially, I know as a mom, we all trust our fellow moms more than anyone else. So talking to friends, gift this at baby showers. This is the book everyone needs more than they need a fancy, blanket or wipe warmer. This is the book that people need. So thank you so much to everyone who joined us. Thank you so much, of course, to both of you. And again, follow Dr. Nikki on Instagram so you can see when she might be appearing at a library or a bookstore near you as well.
And also follow Eve Rodsky in Fair Play Life and watch her documentary on that.
Yes, on Hulu. It's on Hulu. Yes.
Hulu. Thank you. Because I recommend that as well. Read her books, Unicorn Space and Fair Play. It's all intersecting with mental health. And so, yeah, so fabulous. Thank you so much, Eve. Thank you all of you for your support and great questions.
Well, I'm going to just do a little post right now. So, but yeah, very, very, very excited for this to be in the world. Thank you everybody for coming today. And thanks for being with us live.
Thank you.
All right. Thanks everyone. Have a great day.
Bye.
Bye-bye.
Bye, Eve. Bye, everyone.